my name is Dr. Tiffney Widner. I am a general pediatrician. So I work at Children's Hospital of Michigan, but I work in the clinic. So I'm kind of similar to what you all are used to seeing in terms of when you're bringing your kids in for regular checkups. So I am one of those people. Little short background, I was born and raised in Detroit. I left because I wanted to see if the grass was greener, and spent some time in DC. I did undergrad and medical school at Howard University, came back full circle, completed my residency here at Children's, and then stayed on as faculty. So that's kind of me, my story in a nutshell. But yeah, I'm just glad to be here.
It's not greener, is it? It's cool here.
I know,
it might
right?
be colder, but
cool
it's
place.
Right.
And it's cheaper.
In Detroit. Yes.
Yeah, and it's cheaper. That's a whole nother conversation. Yes. But DC is definitely cool. But yeah, we love, and I live downtown. I heard you live downtown. Yeah, I just
there's a
moved
sugar
out of
factory for you. If you have not heard, the sugar factory from Chicago is coming to Campus Martius. So if you have a sweet tooth, it's for you.
Probably information I don't need, but I'll probably check it out anyway.
Totally. Well, you are with Children's Hospital of Michigan, and we're just so grateful to be aligned with them. Obviously, at Little Guide, it just makes perfect sense. And with them being ranked as one of the best in the country for pediatric care, it makes sense to have you on as well, and learn straight from the source. There's just way too much information out there, especially with COVID. So again, we're grateful to you and your time. We're also grateful to Children's Hospital of Michigan. If you don't know, they have been ranked in the U.S. News and World Report 2020 and 2021 for best children's hospital in the nation. So, and it's right here in our backyard. So great resource for us as we lean on you guys today and with all of our questions. But for everyone else, we encourage you to check Children's Hospital of Michigan out. So so like I said, my husband, him too, I should throw him in the mix, but my son said, my throat, it hurts back here. He's only 5, so he doesn't know sore throat. He's like, it hurts back there. And I was like, literally red flags. And I took his fever, and ultimately, he had just woken up. He's like, I'm tired, but he had a long day yesterday. So ultimately he went to school. I felt like it was fine. He had no fever, but what should we be looking for? I mean, what is the difference between, I don't even know what the temperature is out there, but it's not warm. So, 2-3 years ago, we would have been like, you're fine. It's just a cold, or it's just or worse, it's a flu. But how do we know the difference between really red flags in COVID and the common cold or flu?
So honestly, it's really a tricky thing that we're all figuring out together. So you guys aren't wrong in having this like, oh my God, what's happening? We don't know the difference. Because you're right.
Thank you for saying that. And thank you for making us feel normal.
So it's not just you, it's us in the medical community as well. We're having difficulty distinguishing between the common cold, flu, and COVID. Right. And that's what everybody is scared of right now. And the issue is that with all of our respiratory viruses, so viruses that affect our lungs, we're concerned that they have similar symptom profile. So the big thing to worry about with COVID is the fever, but you can see that fever with the flu as well. So we we consider fever as a temperature greater than 100.4. So 100.4.
Really?
Mm-hmm. And I think that's a trick. That's the first tricky thing, right? Because everybody's like 99. Oh my gosh, things are bad.
Yeah.
But by definition, a fever is any temperature greater than 100.4. So the fever is the scary thing that we're looking for. But because we're all being cautious now, when you're seeing symptoms like cough, sore throat, fever, the runny nose, the congestion, we're becoming more concerned. Now, It's the constellation, so multiple symptoms together, that makes us more concerned with flu or COVID versus just having one single sign. So I get it, and I totally understand the process that you went through with your son when he complained of the sore throat, because that can mean so much, right? So we're really looking for a combination of symptoms before we get scared, and definitely the fever with the cough. Those are the things that we're looking for that lean us towards thinking about COVID or the flu.
Yeah, so
Yeah,
what,
I almost felt bad. I feel like I scared him where he's like, no, it's not that bad. I was like, oh no, you can tell me. It's this fine line as parents that we have to walk where I was like, oh no, are you really? Because that could be COVID. And I think I was like, no, but you can tell me this stuff. So we're all just trying to keep ourselves in check here.
Yeah,
So
and I think we're all freaking out together.
That's why service pressure
Carrie.
is on the charts for Encanto fans.
Yeah.
But when would you suggest that families seek medical attention? What are the constellations? When do they all align where you're like, okay, I should call my pediatrician and make an appointment?
So we always encourage, as pediatricians, most of our job is reassuring and calming scared parents down, right? So whenever you're freaked out, I think you should reach out to your pediatrician. Now, there's caveats here because in the state of the pandemic, we're all trying to keep our offices and clinics safe. So you have to reach out to your individual pediatrician to determine what the criteria are versus when they're seeing you in the office or when they're referring you outside. But the things that I would look for is definitely if you have an exposure to COVID or flu, you're definitely going to be more at risk. And if you have that fever that isn't able, you're not able to calm down with Tylenol or Motrin. If your child is not drinking, eating, we know that typically when a child is sick, they stop eating as normal. We get more concerned as pediatricians if they stop drinking because we get concerned for dehydration. So if you can't keep up and get your kid to take that those sips of fluid, so your Pedialyte, your Gatorade, your water, to keep them hydrated, then those are signs that they need to be sent in. The other thing we're looking for is shortness of breath. And if your child is not able to catch their breath, that's a sign that we need to definitely seek medical attention.
Yeah, if they stop eating the snacks, it's red flag central.
Yeah.
Right?
Yeah, it's all about the snack portions. What's the usual timeline from exposure? So let's say we had an exposure. I mean, how many days are we looking at? Should we be on alert or just aware?
So the peak for throughout the pandemic has been around 3 to 5 days. With the new predominant variant right now, Omicron, actually we're seeing that in terms of being contagious, you've been contagious before we start to see symptoms, which is the crazy thing about our current variant and why it's so rampant in terms of how virulent or how contagious, how easily it's spread to everybody. But usually you're talking about a peak of 3 to 5 days. It's similar to the flu. Flu also around 3 to 5 days from exposures when you would expect to see symptoms.
Well, so then the big $1 million question is, how do you protect your family? How do you stay safe from both the COVID and the flu?
So big things that we've always told everyone in terms of keeping your family safe from viruses: wash those hands. That's a big barrier. We know that kids are typical. They want to touch everything and everybody. They're digging up their nose and coughing in their hands. So the biggest barrier that we have is washing the hands. We know that we're all trying to mask up, and that's definitely a big, huge thing. And is actually one of the biggest barriers and protective factors that we have. So those are the big things. You want to avoid those crowded areas. especially when we're indoors. In crowded areas, you want to try to avoid those. So just being smart. A lot of these things we've been reiterating and beating a dead horse here, right? For this past 2 years almost. We've really been kind of beating this into everyone. But there's no difference. We still have to wash hands. We still have to mask up. Those are our biggest barriers between COVID and flu.
I think it's really hard. I really fear, because I have a newborn, that like how, and I have two other children, right? One of which is just like straight by the rule. The second one is everything you said. Everything is in his mouth, like he just hands, nose. It's and then I have my baby, and I'm like, what happens if one of us gets it? How do we separate in the house, or what do we do? And I'm not expecting you to have that answer. It's just something that weighs on me of, with a family of 5, how do you isolate? How do you protect others within your family? So that kind of.
It's hard though. I know I actually have to answer this question on a regular basis, so I get
Oh,
it.
do you? I'm like,
No, we do.
If you have an answer, great. If not, I'm
We
just
do.
voicing the concerns.
The big things are, so we're pushing, there's no secret that in the medical community, we're really pushing vaccination. So we have a vaccine against the flu. We have a vaccine against COVID. What that does is it gives you that extra layer of protection on top of the masking and the washing hands that we're doing. So if everyone that is eligible, so everyone 5 and up, which doesn't help your newborn, but if everybody that's greater than 5 in the house is vaccinated, that gives you another layer of protection. So that's something to definitely think about. You can get infants vaccinated against the flu. We start at 6 months, so we still have a little time. But those are the biggest barrier. That's the biggest extra protection. And then if someone in your house is exposed to flu or COVID, or we don't know, they were exposed to something, they're sick. Cleaning the house with a disinfectant. And so this isn't a commercial or a plug for anyone, but your Clorox or Lysol, making sure that you're wiping those commonly used surfaces down with a good disinfectant is also going to be key in keeping your house protected if one of these viruses were to enter your home. And then being mindful. So if there's one person that is exposed and everyone else has been tested, everyone else is negative, or no one else is showing symptoms, you still want to make sure to quarantine because there is a potential exposure. But you can, and I've had families make the decision to essentially lock that person in a room. You can bring, it's great if you have separate bathrooms. Everybody is not that fortunate because you can separate as much as possible, but everybody doesn't have that capability. So the disinfectants are going to be the biggest thing within the house. And then not having that close contact, having that individual, and even within your house, you can wear masks and frequent hand washing. So those things can still happen within the house that can still form protection.
Okay, so here's another question. So we know that you can contract COVID twice, multiple times. What's the likelihood, like if you got Omicron, what's the likelihood, and is there a time barrier? So Carrie, you can talk, I don't know if you want to talk about, but your experience, but is there a time barrier that you're now like, okay, I got it. Are you safer? Like, not safe, but like, what's the likelihood that you might contract it again? And they're like, well, studies have shown 3 months after something that, we know vaccines, okay, and booster 6 months, okay, but any indication of if you can get it again, and is there a time period?
So they don't have a perfect answer to that question because Omicron just popped up almost 2 months ago. December 1st was when we had our first case within the United States. So with that, the studies are still ongoing. There's thought behind, and there's studies that are currently investigating whether or not Omicron is going to give us more protection. And what those studies are thinking is that if we have Omicron plus our vaccination status against COVID, that's going to form an extra layer of protection. There's some talk about something called super immunity. What the heck does that mean? So basically, what we're saying there is you are with someone that is super immune, so has been vaccinated either before or after contracting COVID and has been exposed to the Omicron variant. There's some studies going on that are saying that you would have even more protection. So it would be less likely that you would contract COVID again, and that you would be able to spread it to others. But the caveat there is,
you keep saying but.
Oh no, we're still figuring it out.
It'd be great if we could just stop there and be like, we figured this out. Oh man. Well, I mean, okay, so the last thing is, not the last, because we could talk for hours on this, but we know that this is not the only reason kids go to the hospital, and we're hopefully not for, we just try our best to keep our kids safe, but things happen. Is it safe to take your kids to the hospital right now?
Of course. So I know the fears. I've seen it. We are just really ramping up in the clinic in terms of visits again, because everyone was scared. And people were avoiding the hospital and even the clinic because they felt like if they walked into a medical facility, they'd get COVID for sure.
Yeah.
What we're doing at our facility is we're making sure that we're protecting our families, be they potential COVID positive or not. We want to ensure that everyone knows that all of our medical facilities, definitely here at Children's, but at most other facilities as well, we're masking. All of your providers are going to have masks on. In a lot of instances, in our high risk instances, so our ICUs, our emergency room, we have the N95 mask plus a mask on top. So we're even double masked for you guys to make sure that we're protecting not only ourselves, but our other families that are coming in that may not have even a hint of COVID. And we don't have that concern. And of course, we're making sure that we too are also sanitizing and washing our hands and our services on a regular basis. So we've ramped up things even past what we were doing at baseline, because we were already washing our hands. We were already sanitizing. But we're making sure that we're sensitive to the fact that COVID, we are in the midst of a pandemic. So it is safe. And you should still go to your pediatrician, to your own doctors, to make sure that you're keeping up with your regular maintenance health visits, as well as if you're coming in for other things. So don't try to fix those broken legs at home. Go to the emergency room like you would, you still need us. And we're making sure that we're protecting ourselves and you guys as much as we can.